Hi all, and welcome to an update from the medical school from today, the 13th of May 2021. You may have seen my email today, which outlined that the Greater Melbourne area has been exposed to COVID-19. So there are public health requirements in place for those of you who have been to the identified exposure sites in New South Wales and Western Australia, and now also in Victoria. If you're in the ACT and you have been to those sites, you need to quarantine yourself, get tested, and please call the ACT Health helpline. However, if you've been, in addition to that, to the Greater Sydney area, that includes Wollongong, the Central Coast and the Blue Mountains on or after the 26th of April 2021, or to Greater Melbourne area after the 5th of May 2021, you cannot enter a health facility for 14 days without exemption. Please check the state and territory and of course the ANU COVID-19 website for more information. Now, some of you may have been able to listen to Professor Gruen, the Dean of the College of Health and Medicine, who gave a college presentation on the College Implementation Plan on Wednesday. The plan was also released on Wednesday, and it contains a summary of the proposal, the initial proposal, the feedback, the responses, the new structure, any staff changes, and the timing of the phased implementation. And for those of you who haven't seen it, here is the important slide really. The college will remain named the College of Health and Medicine. The college will consist of 3 schools, so that'll be the John Curtin School of Medical Research. The Research School of Population Health will be renamed NCEF with 1 P, so the National Centre for Population Health and Epidemiology. And the 3rd school will be the School of Medicine, Psychology and Health Leadership. This is ANU Medicine, so us essentially in one school with the Psychology Research School under ANU Psychology, and in addition to that, the previously proposed CHL, Centre for Health Education Leadership, is going to come into our school as an educational support unit. This is a lengthy document. Please read it in detail. It outlines not just what was proposed, but also what the feedback was about, and a bit more detail on the structure. And there are some ideas on people and where they report and where they sit. I think it is important to know for you that at the moment this is not written in stone. We have a 3-month period till the end of August to develop our school and look at the governance, the reporting, how the educational support unit is going to work, and we're going to all do that together. So read it, give us some feedback, and we'll hold a school meeting on this on Monday the 17th of May 2021 at 5:30 p.m. But I'd just like to take this opportunity to all of you who have provided feedback and who have shown such strong support for the medical school, its identity and belonging, but have also put up really good proposals on what it could look like, which we will take on board and hopefully work with now over the next 3 months. So thanks to all. Now, you may have seen that the promotions round for ANU has opened. This is the promotion for full academic title. This will open from June 1st to end of July. There are information sessions scheduled in May, and the forms will be available when the promotions rounds open. If you have any questions, please contact College HR if you're thinking of applying for full academic promotion to level B or D. If you have any questions about promotion to level E, please contact the academic promotions team. There's more information on the ANU website on this. And an update on the vaccinations for students. So phase 2 students can get vaccinated against COVID-19. Can you please do us a favor and upload the evidence if you have been vaccinated into Sonia under the checks page. This is not a mandatory vaccination, but it really helps us, should there be another outbreak, that we can allocate you to appropriate clinical placements. In addition to that, staff and students can get free flu shots on and off campus, and the website to find information on is under the services.anu.edu HR website. As of the 10th of May, the Flory building will have open doors. Remember, up until the 10th of May. The front doors were locked. You could only get access through your swipe card. So we've opened the doors during business hours. But please continue to use the Check-in CBR app. Keep up with the safety precautions, hand hygiene, distancing, and so on. Building 4 will remain locked. This is a Canberra Health Services building. And in order to get in, you not only need a swipe card, but you also need to use the ACT Health screening tool and get a green tick before you can enter. Now, you may have noticed that there's a lot of construction going on here on Canberra Hospital site. Building 8, or the new Building 8, is nearing completion, and this is going to be a building that will have a lot of educational spaces for the staff development unit, as well as some project offices, but also some offices for the medical school. In addition to that, the Spire building is on track, and I expect some construction to start very, very soon. And if you want to read up more on the design and the details, this have been released and can be found on the ACT website under Canberra Hospital Expansion. I am also aware that ACT Government is working on a Canberra Hospital Master Plan, and that will be available for consultation soon and will give us an idea of what is planned on this campus for the next 20 to 30 years. Now, Sydney Adventist Hospital is our newest partner in terms of clinical schools. An MOU was signed in December 2020, and this really outlined a way to collaborate with our colleagues in Sydney in education and research. And a more detailed agreement is being developed as we speak. We are very fortunate that the Sydney Adventist Hospital is offering clinical placements for our Year 3 and Year 4 students, and the first voluntary placements will be taken up very soon. We held a meeting with the SANS staff last week to give them a little bit more detail around the MCHD, a general overview over the program, but also more details about Year 3 and 4, what clinical placement looks like, what these portfolios are all about. And I must say, I was actually very excited to not only see 61 people on a Zoom conference at 5:30 or 6 o'clock in the evening, but there was a lot of enthusiasm of the staff to help with the teaching. And this is not just in terms of supervision of students in clinical placements, but the ideas that were brought forward were around large group teaching, if it can be done via Zoom, but also academic supervision and research project or higher degree research supervision. We look forward to liaising with our colleagues in Sydney a bit more over the next few weeks, and we'll keep you updated and informed on how the clinical placements are going. The Australian Society for Medical Research of New South Wales and ACT will be holding their annual scientific meeting on the 10th of June 2021. Abstracts are now open, and highlights of the program are the Alan Scarring Memorial Award, the concurrent sessions to allow more oral presentations, a science communication workshop, and there are also multiple awards available for postdocs and PhD students. If you're interested, please go onto the ASMR website. And there are quite a few events happening over the next week or so. Of course, the most exciting is the MedSoc review, named this year Dr. Wonka and the White Coat Factory. This is presented by the ANU Med Review team. It'll be running on Thursday to Saturday from the 13th to the 15th of May. I think tickets may still be available or possibly be sold out, but we all look forward to a great evening. CHM, the Canberra Health Annual Research Meeting, which will be running at the end of July, still has abstracts open. Please submit your abstract by the 17th of May 2021. On Monday, the 24th of May at 11 in the morning, there will be a research ethics seminar held. This will be via Zoom, and the focus here will be on how to manage ethical and privacy considerations for any kind of research that's being done on teaching and learning. And as I stated previously, I will hold a medical school meeting on Monday, the 17th of May. We'll do this at 5:30. Apologise for the late time, but I'd like to include our clinician colleagues who have patient duties until then, and I'll hold it via Zoom. The focus here will be the implementation plan, so I hope that you would have read the document by then and have some questions, and I'm happy to outline everything and explain the way forward a little bit more. So that's all from me for this month on this video. I will actually be away as of Thursday, the 14th of May, for about 10 days or so. If you have any questions, please email Cheryl Morse or Associate Professor Alexandra Webb on deputydean.medicalschool@anu.edu.au. She will be more than happy to help you. Please look after yourself and each other. These are difficult times. I very much look forward to your feedback, particularly on the implementation plan, and I'll see you on this channel in a month. Bye-bye.